Hello, everyone from around the world. I'm sorry that I interrupt in the beginning. But anyway, I would like to welcome you to this webinar, 4 Pillars of Health in All Policies for Sustainable Multisectoral Collaboration on Social Determinants of Health, Equity, and Well-being. This webinar is co-hosted by the World Health Organization, the Global Network for Health in All Policies, and the Center for Health in All Policy Research Translation. And my name is Nanut Maturapot, Head of Global Collaboration Unit, National Health Commission Office, Thailand, and a member of the Global Network for Health in All Policies. I will be the facilitator for these sessions, and I would like to welcome Dr. Horacio Arruda, Assistant Deputy Minister, Health Promotion and Prevention for Quebec's Ministry of Health and Social Services, and as chair of the Global Network to offer a few welcome remarks. Horacio, please.
Hi, everybody. Hi, the world. Peace to the world. Let's see, ladies and gentlemen, welcome to this webinar about guidance to support multi-sectoral collaboration and foster health in all policies. I'm very happy to join you today from Quebec, Canada, as chair of the Global Network for Health in All Policies. In the last 2 years, countries around the world have been mobilizing and are still mobilizing to curb COVID-19 pandemic and reduce its numerous effects. Governments around the globe have put in place unprecedented cross-governmental structures and mechanisms to coordinate their response. However, the pandemic has also highlighted inequalities across the planet and within each country. In this context, multi-sectoral approaches, such as health in all policies, offer promising tools that can guide recovery efforts, address inequalities, act on social determinants of health affected by the COVID-19 pandemic, and foster health equity for all. Therefore, I am proud to be part of this webinar entitled 4 Pillars of Health in All Policies for Sustainable Multisectoral Collaboration on Social Determinants of Health, Equity, and Well-being. The Global Network of Health in All Policies is dedicated to support health in all policies implementation and practices. And we are very happy to have the opportunity to work with the World Health Organization on this new guidance process. And I tell you, you can join the group. We're going to be all together to reduce inequalities and give health for everybody. I now will give the floor to Ms. Nanut Maturapot, Head of Global Collaboration Unit at the National Health Commission Office on Thailand.
Thank you, Horacio. So let's start the network, right? Because there are many activities and information about health in all policies. Now I would like to invite Dr. Kumana Rasanathan, Unit Head, Equity and Health, Social Determinants of Health from World Health Organization. He will come with the video clip on a brief introduction of this important work. The video clip will come up soon.
Good morning, good afternoon, good evening. Thank you to Dr. Nanut and Dr. Arruda for their welcome comments. And it's my pleasure as Kumalan Rasanathan, Unit Head for Equity and Health in the Department of Social Determinants of Health, to also offer my welcome. I apologize that it's remotely to this webinar on the 4 pillars of health and all policies for sustainable multisectoral collaboration on social determinants of health, equity and well-being. I'd like to thank the Global Network on Health and All Policies, in particular Marianne Jarks at the Secretariat, for their support in organising this webinar, as well as Carmel Williams, the Director of the Centre for Health and All Policies Research Translation at Health, for her support for the webinar, as well as her role in leading the work at the WHO Collaborating Centre on Advancing Health and All Policies Implementation, for developing the guidance on multisectoral collaboration of WHO that informs today's webinar. And also I'd like to thank Michaela Toll from Human Impact 5 for her work on this guidance. And I'd like to give particular thanks to our country panelists today, Dr. Besnik, Dr. Mishra, Dr. Aruda, and Dr. Joachim, for making the time to share their reflections on country experiences with health and all policies, and to my colleague, Nicole Valentine, who is very much the lead focal point for this work. Of course, WHO's work on multisectoral collaboration goes back a long time. It goes back to Almirata, which talked about intersectoral action for health, and even beyond. And yet we haven't necessarily seen as much progress on implementing this approach as we would like. And we certainly haven't made the progress on health equity that we would like, as we've seen in the current pandemic, as we see with all of the challenges we face from war and violence, from climate change, and multiple other challenges to health. Reflecting this, in 2021, member states of WHO, the World Health Assembly, adopted a new resolution on social determinants of health, calling for intensified action on health equity, urging member states to redouble their efforts on health and all policies to work across sectors to tackle complex health challenges, and also asking WHO Secretariat to develop a new WHO World Report on social determinants of health equity. The Director General of WHO earlier this year, in listing his priorities for his second term, also signalled that there was a need for intensified efforts on the $3 billion of WHO's work on ensuring health and well-being for people, for which multisectoral collaboration is fundamental, as so much of health is created and destroyed beyond the health sector. On health and all policies, WHO has been working on this for over a decade, including statements from Adelaide in 2010 and Helsinki in 2013. Health and all policies and multisectoral collaboration are key for achieving the Sustainable Development Goals, not just for Goal 3 on health, but for all of the goals. The Sustainable Development Goal agenda, of course, is framed as an indivisible, integrated, and interdependent agenda. And health, like other complex challenges, requires inputs from all of societies. I'm very much looking forward to hearing from our speakers today on the 4 pillars and on the guidance, and then from our country panelists on how these principles are being used and how health and all policies are being used. What do they want more support from WHO, and what has led to success in countries, but what are the remaining challenges? And as I said, all of these reflections will help us to finalize the guidance, which we hope that you'll all be able to read later this year. A final thank you to all of you in the audience for joining us today. We know there are many demands of your time in this period, and it's great that you're with us to hear from our speakers, from our country panelists, and hopefully together we can make much more progress on working across sectors to address the social determinants and actually reduce health inequities. Thank you, and I wish everyone all the best for the discussions today.
Thank you, Kumbanan. Even though he's online, even though he's on the video clip, but I still want to thank him for this informative information. But before going to the next sessions on the outline of the new guidance, I would like to inform you of a few housekeeping information. The webinar is recorded and will be posted on our website of the network. And if you have any comments or questions, we encourage you to share them in the chat box. We are sorry that we don't have the Q&A sessions during this webinar, but the questions you submit will be used to inform upcoming Q&A sessions on the guidance document once it's released. And these sessions, these Q&A sessions that we're going to organize later will be offered in multiple languages and time zones. And we will send all webinar attendees to the link to access those Q&A sessions. And now I would like to invite Dr. Nicole Valentine, Program Lead and Technical Officer from WHO, and Ms. Carmel Williams, Director Center for Health in All Policy Research Translation, to provide us with details around this new guidance. Over to you, Nicole and Carmel.
Thank you, Nanoot. Thank you very much for that introduction, and thank you to all the participants and the panelists. When we started developing, next slide, please. When we started developing the guidance, we were looking at what we saw as problems of implementation in the environment where you want to work across policy sectors, which is essential for addressing the social determinants of health. Some ways of looking at those barriers are illustrated on this slide. The first area that provides a barrier to working across sectors and for multisectoral action are a group which we call ideological barriers. And this really refers to the fact that the social determinants of health equity agenda has been seen or is seen as an agenda that is politically associated with the left. This hasn't always been the case. If you look at the Sustainable Development Agenda that was pledged to by many different governments across the world, from different parts of the political spectrum, there is a strong emphasis on addressing social inequalities, which, as you know, are strongly related to health inequities. So the one area is the ideological barriers, and this is something which we continue to work on, and the World Report that Kumanan mentioned will be addressing this narrative on health equity to look at as a common vision of to build a fairer, healthier world for everyone, everywhere. The other area of barriers relates to what we call technical barriers. And this really, you see when you look at the literature, anyone who's done literature reviews and trying to understand what are the co-benefits of policies, you will find prior to 2015, very, very little in the literature looking at co-benefits. And co-benefits are very important for designing the technicalities of the policy with the other sector and really being able to offer better intersectoral cooperation. Finally, there are what we're terming operational barriers. And this is really where this new guidance we're hoping to contribute most. Some of these operational barriers relate to how institutions and the people in these institutions have a misunderstanding on what the social determinants of health equity are. And this is often starting in the health sector itself. There's also a limited integration of the social determinants of health equity as a consequence in the routine and regular functions of health systems. There's a limited focus on interventions that address structural determinants of health equities. There is also generally an underrepresentation of the voice of communities and limited spaces made in these institutions for people and from different sectors to work together and ensure policy integration. So really the setting of the scene, my first slide has been the longest slide, but it's really to provide a bit of the background to focus in why we focused on the 4 pillars that we did. So just again, a step back and overview, what are the health in all policies functions? This is taken a lot from the Adelaide statement in 2010 on health in all policies, where when you have health in all policies up and running, you're looking at functions related to translating evidence, which on co-benefits, facilitating interministerial meetings, scanning policy and political environments, future scanning that is, forming the coalitions and networks, identifying opportunities for collaboration, navigating different agendas, looking at co-design and co-production for co-benefits, and here the analogic translation is very important, obviously, and then applying the health and all policies, processes, and tools. So that's roughly what is common wisdom on the functions. And why? So why did we want to come up with this new model? Because we wanted to respond more to this issue of having practical advice on operational issues, to overcome some of the operational barriers and to embed institutionally and with people and resources the practicalities of the health and all policies in systems, and to provide guidance for that. Having the operational elements in place can also help support technical and addressing technical and ideological barriers, but that's not the primary focus of the guidance. And then we also wanted a guidance that would talk specifically linking to health equity and the social determinants. Previous guidance hadn't done so. So here we have the new model, and there are 3 parts of the model that I'm going to provide an overview to before I hand over to Carmel, who's going to go into the final part I mentioned, the 4 pillars, in more detail. Firstly, you will see at the top the rainbow, or the arches, what we're calling arches. And this really is to remind us of the global and national forces that are really either driving or ameliorating the structural determinants of health equity. We then also make a specific reference to the structural determinants of health equity as really what the health in all policies is trying to address. At the bottom of this diagram, you'll see what we call the foundations, and these are really enablers or facilitators within the governments that can facilitate the culture of collaboration, which is so important at an operational level. And the first area or the first principle really is, what are the principles that government has with respect to bridging gaps across sectors? Do they sort of recognize that there can be misalignment of policies, and do they have in place ways to deal with this? The second area I wanted to refer to was, or that the model tries to refer to, is really looking at what are the government values with respect to the what is sometimes called common public goods. And really, I suppose this can be all summed up by to what extent the institutions in governments are actually encouraging collaboration or not in the existing forms of governments, both between the national and the local levels and across sectors. The third part, which is really the meat of what we're going to look at today, are the 4 pillars. I'm just going to give you the headings of what they are, and then I'm going to hand over to Carmel, who's going to go into them. So the 4 pillars we see as the tent pegs. If you could imagine you're erecting a tent, or if you're erecting a building, they would be your pillars. But if you have a tent and you only have 3 tent pegs, and your tent requires 4 pegs, your tent won't stand properly. And that's the kind of analogy we're seeing with respect to these pillars. The first is governance and accountability. The second is leadership at all levels. The third is ways of working for health and all policies action, or work methods. We're sort of looking at different titles there. And then the 4th is resources, financing, and capabilities. So now, if you go to the next slide, you'll see just a summary of the 3 parts of this new model. Next slide, please. Oh, it is there, sorry. And then I'm now going to hand over to Carmel to go into the 4 pillars in more detail. Next slide, please. Thank you.
Thanks so much, Nicole. I really appreciate you setting the scene so well. I think actually we probably want to move on to the next slide as well. Thanks, colleagues. So before I So I'm going to spend some time trying to talk to you about and provide a bit more detail unpacking each of the 4 pillars. But before I start, I really just wanted to emphasize that the 4 pillars don't have any order or any priority. And this has really been set up so that we want to acknowledge that there are many drivers for initiating and sustaining health and policies. And we sort of acknowledge that they need to be applied according to each country's context. So we really recognize that the 4 pillars will need to be adopted and implemented within countries, seizing the windows of opportunity and the sort of that they can leverage to establish a health and policies approach or to sustain it or strengthen it. But I also want to mention that we feel fairly confident that for successful collaboration, we really require the adoption of the 4 pillars, or some elements of each of the 4 pillars. So as Nicole said, we're certainly not suggesting that you could do governance and accountability, leadership or levels, and not have the ways of working. So we're really suggesting that each country and each jurisdiction really needs to work towards adopting at least some element of each of the 4 pillars. And so as I move through and talk through the 4 pillars in more detail, I guess what we've done when we've been collecting this guidance together collectively, and we've worked on it for a couple of years to really think about how it might operate. And we've tested it with a number of countries to see how it resonates with them. So we really are drawing on sort of the best knowledge that we have around how to work multisectorally in the framing and shaping of the 4 pillars. I'll move to the next slide, please. So the first pillar I'm going to talk about, not the most important pillar, but the first pillar I'm going to talk about is governance and accountability. And the purpose of governance and accountability is to provide the mandate and the high-level authorising environment that enables us to work across sectors. Many of us have worked in the health system for a long time and understand that it's very difficult for us to sometimes engage with partners in other sectors. So by having this high-level authorising environment and this legitimacy to be able to work collaboratively really opens up those opportunities and enables us to move forward. Ideally, what we would look for in governance and accountability is we'd like to see a number of these elements or all of these elements in place. But again, we recognise this is not always possible. And so it really depends on country context, on which of these elements you might be able to harness and to implement. I'm going to unpack just a few of them in the interest of time. We don't really have time to cover them all. But so one of the things I want to talk about first is really how governance legitimizes multisectorial work, and it provides really a mechanism for action and provides also structures of accountability. So the mechanisms and structures that are provided under the governance and accountability pillar really enable health and policies practice to operate. These structures and mechanisms really provide a scaffolding to support health and policies practice. An authorising environment can be provided in many ways, but for example, a statement of support from the head of state, such as the Prime Minister or the President, can provide the authorising environment that really opens up the opportunities for action across sectors. And I think a good example is the United Republic of Tanzania, where the Office of the Prime Minister is actually responsible for multisectorial action. And this is really facilitating conversation and dialogue across multiple agencies. A whole of government plan is also another important part of the governance and accountability pillar. Why a whole of government plan is important is because it can provide a clear shared vision. It lays out the objectives for cross-agency collaboration and investment. Such plans can be rallying points and to help unify policymakers across sectors. It is recognised that development of these shared visions can be time consuming, but the investment can be worth it because these can be powerful tools for building shared ownership, which is really an important platform upon which health and policies and multisectorial practices work. And a good example of this is our colleagues from Quebec with the prevention and health policy, which was developed under a central government mandate. And it's really been building a common vision on what population health is for Quebec. And it's been identifying synergies between sectors to really help enhance the collaborative culture within the Quebec government. Next slide, please. So this slide here is really just to highlight that here are some of the different structures that operate within governments that can be utilised to support multisectorial action. It also identifies the roles that these structures can play. And so it's really just to provide you an example that there is multiple different types of mechanisms and structures that can support cross-government collaboration. Next slide, please. So leadership at all levels is the second pillar that I'm going to talk about today. And many of us probably, when we think about leadership, we think about executive leadership and executive power. But I think what we found here in health and our policies is that it's incredibly important for us to recognise the valuable role that leaders within multiple parts of government systems play. And so this pillar is really speaking to the need for executive leadership, as I've mentioned in the previous governance slide, but it's trying to encourage us to think about and support emerging leaders at other levels in the system. Those leaders may be the executive, but they also may be managers, policy officers, even technical people. So it's really, so we're really looking to have these leaders supported. So leaders with vision can emerge at any level. And we really want leaders working across the multiple levels in government agencies because this can foster collaboration and can really be a bridge between sectors. Leaders of health and our policies really ensure that the conditions are in place that help others to collaborate. They foster a culture of collaboration. And a good example of this is Bhutan's gross national happiness strategy, which really applies health and our policies through leadership and governance structures. People who lead and advocate for health and our policies approach become agents of change and HiAP champions. HiAP champions really mediate the different interests, they build networks and they foster collaboration. These champions are really important because they're both inward looking, they understand and know their organisations really well, they understand the priorities and principles of their organisations, but they're also outward looking. They're looking out into the role of the other sectors. They build networks, they build relationships with people in other government agencies, they build relationships and networks with people working in academia and across disciplines in academia beyond the health and human services sector. So these champions play a really important role in fostering the collaborative endeavour and building networks that can be utilised when we're wanting to apply health and policies approaches. Leaders also create opportunities for others within their circle of influence to develop the knowledge, the skills and the confidence to work collaboratively. And an excellent example of this type of approach is Thailand's National Health Assembly. It's a great example of how knowledge exchange is operationalised at multiple levels in the system and how they've gone about identifying a whole range of health and policies champions. Next slide, please. So this slide is really just a summary of some of what I've been talking about. It's talking about the need for both vertical governance, which is we don't want to disrupt the vertical silos that operate in government. They're really important and we see them as valuable as part of our health and policies practice. But what we're trying to do is strengthen the horizontal governance, how we can work across sectors, how we're able to have people working at multiple levels in the system to be able to really permeate the silo boundaries that exist in so many of our government departments. Next slide, please. So the ways of working, and this title has been coined from the Adelaide 2 statement that was developed in 2017. And it really talks to how we behave as collaborators. It really asks us to reflect on the attitudes, mindsets, and behaviours we bring to the collaborative process. So being able to communicate effectively, taking the time to understand the drivers and agendas of our partners are important when we're working using a health and policies approach. These features are fundamental to establishing and maintaining trusting, respectful relationships. And these relationships are critical to effective health and policies and other forms of multisectorial practice. So you might recognise that our belief is that health and policies is really based on relationships and the concepts of mutuality, that we're working towards a common goal, and reciprocity, that actually we're working together to get something out of it for me and something out of it for you. We're wanting each to benefit from the collaborative process. And through these approaches, you can develop open, trusting relationships, and using communication can really help to hold the partnerships together. Without trust and open communication, long-term collaboration is not viable. So trusting relationships at the heart of this health and policies approach. It's also important to take time to understand partners' policy priorities and their motivations, their interest. And this is really useful when you're trying to first engage with new partners. And then from there, you can build on and you can start to work together using co-design methods to develop policies, projects, and activities. And I'm now going to indulge my own personal experience. And here in South Australia, we've actually really relied very heavily on co-design, co-production, and co-benefits approaches to be able to move forward. So now we move to the next slide. Thank you. So this is just a highlight of co-design, co-production, and co-benefit approaches. So the last slide, please. So it's often assumed that working across sectors or working on collaborative approaches can be done in everybody's usual day job, and that it doesn't really take any additional resources. But actually, health and policies work requires resources. It requires the allocation of sufficient, appropriate resources. It's just like any other important priority. If we want it to be successful, it needs investment. These resources specifically, these resources need to include both dedicated personnel and dedicated financial resources. It's important that the people have dedicated roles for delivering on health and policies, activities, and approaches. You need one or more staff to really be responsible for overseeing the day-to-day management and implementation of health and policies activities as their primary role. So they have sufficient time to prioritise these activities. We also want to see dedicated health and policies budgets and mechanisms that enable these budgets to be matched with those of partners to support co-production. And ideally, wherever possible, we'd like to see these budgets aligned to the common goals, common priorities working across sectors. And lastly, it's also really important to invest in capabilities. Health and policies practice isn't necessarily something that we're all taught in our professional development. So it needs to focus on how we can work across diverse policy portfolios, how we can work together to navigate competing interests, and how we can develop the skills and diplomacy to be able to progress. And that's me. I hope I haven't gone too long, sorry.
Thanks, Kamal. Now to the last two slides. So in setting up health in all policies and strengthening multisectoral collaboration, we're hoping that there will be improved value in public policy making, that there'll be strengthened government systems and structures to increase action on the Sustainable Development Goals. It will also advance universal social protection coverage and sustainability, which is so fundamental for addressing health inequities. It'll advance transformation to well-being economies, which is a big policy on the agenda, and in all generate better health equity, social equity, well-being, and environmental sustainability. Last slide, please. So in summary, public policies and institutions do matter. We believe this strongly. And on the right, we refer to the Tour Grenfell, which happened in London, where many people lost their lives because of discriminatory policies, entrenched discrimination in institutions. So we hope that this guidance can contribute to building institutions that really are geared and capabilities that are geared to addressing the social determinants of health equity and well-being for all. So thank you for taking time to listen, and I'll hand over back to Nanut.
Thank you both, Nicole and Kamal, for giving the clear overview of the new guidance. I think the guidance is very practical, and it seems that you develop it based on experiences of many countries, not based on ideology. And the outcome of the guidance that Nicole mentioned, it's not the outcome of the guidance, but the outcome of the collaboration of many countries to apply the guidance. But anyway, I still want to know how the country panelists who have hand-on experience working across sectors in their countries think about this new guidance. I am honored to introduce the panelists who are with us now. I would like to, first of all, I would like everyone to turn on the camera, please. Right, thank you. So I would like to introduce the lady first, Dr. Sangeeta Mishra, Chief of Health Coordination Division, Ministry of Health and Population, Nepal.
Hello.
Good afternoon to you.
Good afternoon.
And Dr. Catherine Joachim, Head of Health Sector Secretariat, Ministry of Health, Tanzania. Good afternoon as well, right? And Mr. Peter Besnek, Center for Health and Development, Moscow, Slovakia in Slovenia, and Director of WHO, Collaborating Center for Cross-Sectoral Approaches to Health and Development. Hi.
Hello.
And again, Dr. Horacio Arruda, Assistant Deputy Minister for Quebec Ministry of Health and Social Services. Hi. So we got all different countries from different continents, which is, I'm sure that your experience are diverse, and this will be useful to WHO to think about the new guidance. I have a few questions, but very important one, and I would like this to be more interactive. I will just like point out who answer or respond the questions first. The first question is, in thinking about your experience in working with other government ministries to address social determinants of health, well-being, and health equity outcomes, please describe how the guidance and the 4 pillars resonate with your understanding of working across sectors. I think the lucky one will go to Sangeeta. Over to you.
Okay, thank you so much. And first of all, I would like to thank you for the wonderful presentation, and I would like to congratulate on this wonderful guiding document. And it's my honor to present here. In my experience in Nepal, actually what we were doing before this year, so there were sectors and they were doing some bits and pieces. So Ministry of Health was doing something, and then other sectors were doing few things, but they were never collaborated. And I'm very happy to say that this year we actually came up with our multi-sectoral action plan. And I'm very proud to announce that we launched that program, plan on World Health Day. And it was kind of very deliberate because we really wanted to, align us with the healthy world and the nations itself. So when I talk about the pillars which Health in All policy says about the governance and accountability part, our multi-sectoral action plan says that we have actually designed it in our national context. Many of you might not know that we have devolved in a federal structure. That means we have a federal government and then provincial and then local government, and each government has their independent mandate. So now what we have done, that we have formed committee across all the governments. So now there is a high level committee at the federal level, and then that has its own clear TOR, and they have different kind of roles and responsibilities. Similarly, we have 7 provinces, and each province, in each province, we have actually designed a TOR, a clear TOR, and that is led by the principal secretary in the province. And similarly, in the local governments, I must say that local governments are quite independent, and they have their own governance structure. So the mayors of the local government have been empowered to implement this MSAP. And then about the leadership, actually, have, as I already mentioned, that we have made high-level committee all across the government. So it's like going, it's both vertically down and horizontally. So that is, the leadership is being taken by all the levels. And in the third pillar, which we mentioned about the co-design, different groups have been involved, like civil society, academias, community-based organizations, non-government organizations. And when we were actually drafting this, our multisectoral action plan, we had constant discussions with all the stakeholders, and we did involve all the professional organizations as well. So Nepal has taken an approach to co-design this multisectoral action plan. And on resource, finances, and financial capabilities, what we have done, that we have dedicated the role of the line ministries. So now with this document, we do have a clear definition of the roles and responsibility of the individual ministries, and we have made sure that they have identified budgets and finances. So in a whole, the guiding document which we have now, Health in All Policy, that equally resonates with the Nepal's multisectoral action plan. And I'm very much happy to share this, that we are planning to do our first steering committee meeting quite soon, and we will launch this document all over the country. Thank you so much.
First of all, I have to congratulate to Nepal that you're going to launch the multisectoral action plan soon. And it seems like from your experience, I'm happy to hear that the way you work is associated with the governance, with our guidance. So meaning that the guidance is quite practical based on real experience. But I also would like to hear from Peter how you resonate your work with this guidance.
First of all, thank you for inviting us to this great webinar. We are also honored to have the opportunity to present our work, some of our work at least. I would like to emphasize that our cross-sectoral work was done mainly on a regional level, and we were reaching out to the other sectors from regional development sector, so not directly health sector. But of course, with support of Slovenian Ministry of Health and WHO Venice office. So we have more experience on the subnational level, maybe in contrast to other panelists. Well, to be honest, I wish we had such a guide back then when we started this work, because when we started, it was learning by doing, and we had many setbacks, of course, that could be avoided if we had such comprehensive guide that is coming actually from real life practice from actually all parts of the world. And this is really something that is of great value if you start something in this direction. Well, so saying that I'm coming from regional level, but I think that even though there are some differences in cross-sectoral work for health in regional, national, or maybe even international level, I think this guide covers the core of question of how to do it. I mean, in all these 4 pillars and for all the levels. So I don't think that it needs any adjustment in this way. It can be used either national or regional or local level as well. So, and also I think the good thing about this is also, somebody mentioned it also earlier, that you can pick different things from different pillars, since it's not written in a way that it should be followed step by step, but rather in the manner you can pick what you need and what you can use, and you just take it off the shelf, as we say. So I think it's very practical and it can help avoid a lot of stress in the process of establishing and maintaining cross-sectoral collaboration. And if I may add, not exclusively for health or health sector, but I think across all the sectors in this are determinants of health palette. So everyone can use it, not only health sector, I think. That would be my first thoughts. Yeah.
Right. I love the way you said learning by doing. I think it's you will have a technique and strategy. While the guidance is just the framework, but learning by doing is you come up with your own experience. But I'm happy to hear that even though you have your own experience, but it's related and relevant to the guidance that we developed. And that's very useful. And thank you to say that this guidance is easy to apply and able to apply at any administrative levels. That's brilliant. May I go to Catherine, please? Kathleen? Kathleen, may I, can you unmute, please?
Okay, thank you very much, Nanut, for inviting me to share the Tanzania perspective on the how do we resonate the framework that has just been presented by Nina. I think when reflecting from when we started developing this framework in 2018 here in Tanzania, we applied much of the 4 pillars, but our focus was mainly on the governance side. As you had indicated before, actually, in Tanzania, we had to identify which ministry can coordinate us, can coordinate all the sectors that are earmarked in the social determinants of health. And in Tanzania, this work is done by the Prime Minister's Office, which has the overall responsibility of coordinating all sectors. But before that, also, we used an experience of One Health approach to really formulate the actors for the health and all policies. So as of now, actually, we do have a draft health and all policies framework, but from the presentation of the 4 pillars and the arches, I think probably we need to go back and reflect what other areas of the pillars are really relevant to make sure that we have an implementation of what we have. And I can give an example. You see, in the pillars, we also have some reflections on the ways of working. Actually, when looking into Tanzania, we do have a devolved government. And with that draft, we have thought really we need to make use of those structures at the subnational level, because much of the work that has been done is mainly at the national level. So what I'm thinking is just to see what will be the relations between the structures in relation to the health and all policies. Yes, we do have the relations, but if we do have a common goal of reaching the health outcomes, we really need to think more. Another areas of interest that has come in is the area of resources. And here, I think when we look on our draft, this area is not really much focused. And one of the questions that I do ask myself, yes, these sectors have identified the areas that they are going to work on in order to reach the health outcomes. But looking on the allocation of resources, probably that one we need to think through and see how can really the strategy align to these areas. Another thing is also the allocation of the human capital. that can work on it, because when you look on the current structure, actually the individuals that were engaged in the formulation of this health in all policies framework had other responsibilities. So when Nicole was presenting, it came to my mind, probably we need to have dedicated individuals that will push forward the agenda of health in all policies. So in a summary, I can say that the document or the thinking that has been presented on the 4 pillars actually gives a clear picture on how the government ministries can improve the way of working to ensure shared goals and intersectoral collaboration in addressing social determinants of health, well-being, and equity. So I can also comment political will and leadership should not be underestimated when working across sectors. So we need really to see how we can have a political will in each of the pillars. Thank you.
Thank you very much. Good point. Good point that the political will for each pillars is also important. And I think the guideline or the guidance will, even though most of you have experience working across sectors already, but I'm sure that the guidance will give you a new perspective that you haven't thought about that while you're working. Can I move on to Horacio, please?
Yes, first of all, I want to make a big hug to everybody. We don't see everybody, but I think we are in the same world and we want the same objective, health for everyone and reducing inequities. First of all, I want to thank Nicole and Carmel for their work because in fact, I realized that this guide, we did some of the pillars and we are doing it, but more in the intuitive way than a structural one. And it's a good timing for me, even if we had the health in all policies begun in 2016, we must be patient because, you know, a government is complex. We are working in complexity of social determinants. There is different objectives and try to find, I would say, the way of changing things take time, but we must continue in that perspective. First of all, I would say that the government accountability is very important. And actually, this is something that the Prime Minister must understand. And the office of the Prime Minister understand why we're doing that, because there is already all kinds of strategies of approaches in the different ministries, but there is a problem of silos. We must take off those silos. We are assignment in between the pieces that are very big. So, and I think it's important to work that at the administrative level with the deputy ministers, with inside of the government. You know, even if we change 3 times of government, we still keep that health in our policy approach. And that is important. So I think the government accountability is very important. The other one is the resource. You need some finance. I would say we don't get enough for what I think, but that's not the only money that is put in prevention. There is a lot on the other sectors, but we can't have a potentialization of what is invested. And I think that is understood also by other ministries because we get some money that we share with others. So there is a win-win situation. And another very important issue is about the way of working. For me, it's a win-win situation. You cannot arrive as a public health missionary telling others, oh, you will do that. It's a way of constructing, and I'm sure that others will find in their own programs ways of doing it in a better way that will make more coherence and will not have health impacts, negative health impacts. So I think it's the way we should maintain those relationships in cross ministries at the higher level. The other aspect, and I'm gonna go doing that for the next phase, there is leadership, but really organized leadership at all levels. You know, At the ministry levels, at the government levels, we give orientations, but we are not making the operations in the field. Municipalities, the local government is very important. And working with the people who are at the regional level, near the local level is major. So we need to have our leadership working with that, but also having stakeholders, what Carmel called HiAP champions. They must understand, because at the end of the day, we want the population ask for more prevention. You know, people ask for more treatments, more cancer treatments, more emergencies, more doctors, but sometimes they don't ask more prevention. And if we want to keep a healthcare system free to reduce inequalities, we must work on determinants of health. So I think those 4 pillars are very important. I'm happy, I'm waiting for that document, I will tell you, because I'm going to use it to explain and say, it's not Dr. Arruda's idea only, it's WHO is telling us the way of doing good business, and around the world, it helps. It's going to help me even to make sure, you know, the work is never finished. In public health, don't stay and say my job is done. It's incredible. It's a moving target. And I want to thank Carmel, and I'm waiting for that document for those, I would say, screens and graphics that really synthesizes where are the places we must work in. And I'm sure even if we have different contexts across the world, we must adapt to our own context, but this is probably the same everywhere in the world, because governance, priorities, the way of working, the mindset we're doing, and money is always needed to do the job. But I really thank you, and I hope that document is going to help everybody to convince their governments that that's the way to go.
I think good point that the guidance is not just for apply it, but also to use it to convince the government and other sectors. That's a good point. By the way, even though we haven't seen our participants yet, but I would like to inform that we have about 180 participants to attend it. So we got warm welcome from them, I'm sure. Thank you for all, and it seems that the guidance and the 4 pillars go along well with working across sectors from your experience. But can you please provide a brief example of how your work has exemplified the importance of one or more for the 4 pillars in your practice? I would like to know about your work now. May I start with Peter first? Thank you.
Okay, so that's us, and we can move to another slide. Next slide, please. Okay, I was thinking how actually which pillar was the most the question that you showed us what we used the most in our work in our region. So I decided to show those 2 that we use the most, but it doesn't matter that the other 2 are not important. Yes, they are. But first of all, you need the mandate, you need the governance first to start working, and of course you need resources, and this is also important. But let's concentrate on how. So advocating, as we saw, it's the most important thing. Of course, without advocating, you will not even get to the practicing of cross-sectoral cooperation or even health and all policies agenda on the table. And it is the same in the region. So you need advocates, you need champions, you need people that will go and find other people in other sectors that share our values, that want to make people's health and well-being better. And of course, you have to do it prior you start the process, so you have at least some knowledge and some capacities in place, and of course you need to do it in between because you want to keep people working with you, and of course you have to be advocating all the time in order to sustain this cross-sectoral collaboration. So this is a very, very important point that is of course in the guidance also very much in front. We were talking about the culture of collaboration. This is really, really important. We think that somehow people, when we come from this sector, let's say public health, we like to think that people are willing to collaborate, that people really, really want to contribute, but sometimes it's not so easy, or it's hard for them go outside their working task. So such leaders or such champions or such, let's say, systems or structures of cross-sectoral collaborations in place could then learn or teach people how to collaborate together. And if I may be a bit bold, I would say that this culture of collaboration is also an outcome of intersectoral cooperation. It's not only the input necessary, but it's also a goal on itself. So people are learning how to collaborate with each other, and everything is easier in life, if you ask me. The next thing that I saw very important is building the capacity to work. And this is, of course, public health sector knows about determinants of health, but let's say health systems are not already so much. And if you talk to other sectors, of course, they don't see how they contribute to the overall health of population immediately. So I think it's very important to show them how their work, daily work, is influencing health and how they can improve it even without any additional resources. We had many scratching heads when we presented how their work is influencing it, and they usually say, oh, really, we are doing this, oh my god, okay, let's do something together to improve it, or let's say, let's do it in a better way. So I think building capacity, having workshops, presenting things to other sectors that you want to work with is very, very important, and do it constantly. Next slide, please. Ways of working. Coming from practice, when I saw that pillar in guidance, I say, yes, 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 this is really needed, because we need to know it's hard to imagine coming from your own sector how somebody from other sector will take your ideas or uptake your ideas and be so enthusiastic about improving health and so on. As Dr. Horatio, I think, said before, we cannot go around and tell people what to do. We have to have partners. There's a key word, work with partners. So we have to have partner attitude. So we have to be one of the partners, not in the center of them, not above them, and work about their goals also that can help towards achievement of our goals. And I was thinking also the tools and processes used to implement, embed, and sustain multisectoral action. This is also something that we will talk about later, how to sustain it. But in a way, we saw on a regional level, we don't have this possibilities to put any funded resourced structures in place that would then work regardlessly, but we could or managed to make regional action group together of the institutions that were based on the first of the common values that we have, and also on the capacity building, were voluntarily willing to participate in this intersectoral cooperation in order to make a strategy or regional development plan that will include also health and well-being of the people. So this is also really, really important part of the pillar ways of working. So the tools, processes, and everything you have to think ahead how you will sustain your multisectoral action and collaboration. So this is for now from me. If there will be any questions, I don't know how we will handle this, but I hope you get the point or the basics. Thank you.
It's definitely useful, and I would like, because we a bit have run off time, may I go to Catherine, please?
Thank you very much, Nanut. My reflection will go into the governance and accountability. As I indicated in the first questions, actually, we now have the first draft for the national. So with the coordination structure, I had indicated how we are working. And actually, I'm pleased to inform you.
I've lost my sound. The sound seems to have gone.
Hello? Can't you hear me?
I can hear you. I can hear.
Okay. So probably from when we started this exercise, we have seen the government coming with the coalitions, and so far we do have more than 5 coalitions that are being coordinated by the Prime Minister's office. We have a coalition of the nutritionists, violence against women, children, HIV, disaster management, health and all policies. And you find that there is an interconnectedness between the health in all policies forums and the overall sectoral initiatives. And I also indicated in my first statement, we do have 17 sectors that are really focusing on these social determinants of health. And what they have done, when we started the process, we did a policy analysis for these sectors to see what is the composition of the policies that are pro-health. And in terms of capacity building and advocacy meetings, we have had advocacy meetings with the directors of policy and planning and the policy analysts. But in 2018 also, we had an opportunity of orienting all the 17 permanent secretary who endorsed the roadmap. And another area that we have done on capacity building and advocacy meeting is an appointment of the health and all policies focal point in each of those 17 sectors. So what we usually do, we do have meetings like when we're formulating our framework, we're meeting from time to time to provide inputs and see probably how these sectors have adopted the policy areas in their either budgets and so forth. So you find in a year, we do have like not less than 2 meetings to capacitate ourselves, but to see any changes or any improvements that need to be in the national policies. And also another capacity building, the WHO country office, they have done several sessions of capacity buildings to this national focal contacts on social determinants of health. And with these new pillars, actually, we are thinking there will be a capacitation and see how best we can adopt some of the areas that are missing in our framework. And also another key milestone that was done was to accommodate the health and all policies framework in our health sector strategic plan. And actually the health and all policies, it's one of an outcome for the sector plans. So you find by doing so, it is influencing the processes that are used and also the health systems inputs. Next. Next slide, please. So
by the way, for challenges, can we keep it later? It will be
okay.
The secret at the moment. But thank you for your work, which is very comprehensive. Thank you. I also would like to hear from Horacio about your work. Over to you, Horacio.
Okay, thank you. Next slide. I'm trying to give you examples of the importance of one or more of the four pillars. I think, and my colleague told that the leadership could be at all levels. I think it's very important because the action is actually, I would say, in the field. That's where the environment, it's where we can change things. Like if we talk about, there is places where there is no good food for different reasons. They are almost where there is vulnerable populations with less money. So we have all kinds of projects, and we do work that in a cross-sectorial regional tables on healthy living habits. We created in each region a cross-sectorial regional tables of healthy living habits with all kinds of people from different sectors, different ministries at the regional or local level, and also working with governmental and non-governmental leadership, trying to have a win-win approach. Like here, we see different kinds of projects, all kinds of projects. We are seeing a community wants to give more good food, I would say, and transforming even areas in the city where it's not well done. There is some, I would say, different fields that are transformed as parks with, I would say, some food, communities trying to help them to have better food around. And that is work, I would say, with a share and common vision and goals on different problems. The other next, it's clear that, we have work also trying to help, I would say, different levels to really understand what are the impacts of their different policies. We have here I would say, a schematic of, I would say, the different determinants of health. It's complex, but we have helped, and we will do that, help, I would say, the other sector, especially, I would say, the municipalities, the local government, to really make in their way of doing different policies, always look at health impact assessment. So we could tell that case success of factors that happened before was to support, to give them consulting services and training, to recognize that approach at the regional level, because we can do that, I would say, at a national level, but it's important that the ones, I would say, the leaders and the ones governmental level at the local level, that they recognize the approach and by different steps, we will find really, I think, win-win situation and trust building and trust in between work. And sometimes it begins with a small project. We develop, I would say, that complicity, that partnership, that confidence that makes public health in a good way in terms of relationship of a win-win, I would say, situation. So that's what I want to add to what have been said from my other colleagues. Nepal, right. Beautiful. I want to be there.
Right. Shall we go there? But before going to Nepal, let's hear from Nepal first.
I think you all should come. So again, welcome from Nepal. And this is the photo of Mount Everest and other places. So next slide, please. Next slide, please. Yeah. So about the Nepal, what we have been doing, what I want to show, I already said that we just launched our multisectoral action plan. So as you can see that why we did it, because on the right hand side, you can see our disease burden. Road traffic accident and NCDs combined, we have around 79%. So like 79 people will die out of these. So that was the main thing which drove us, and we actually pushed from to the cabinet that they should launch this program and they should do this, endorse this document as soon as possible. And on the left, you can see a picture that on World Health Day, our Honorable Minister of Health, two secretaries from Planning Commission and Ministry of Health, and an honorable member of Planning Commission, and there were many important people who are involved in this document and these in this approach. They were called and they all launched this multisectoral action plan, which means that they are owning this document. Can I have the next slide? According to the health in all policy, you can see in this that we have formed committees all across. So there are horizontal committees as well as vertical committees, and these are the federal level committees, which includes the chair is being done by vice chair of National Planning Commission. So this is the person who was like mainly responsible for all the planning purposes in the country. And then we have 16 high level members from various line ministries, and these members are all secretaries from the line ministries. So that gives the vigor to this program, that they are going to own this program. Similarly, we have committees at provincial level and at the local level, as I already mentioned in the previous question, that there are committees all across. But we do have, like, in addition to this committee, we have a provincial level coordination committee, which will work in coordinating federal level to the local level. So at the most, we are doing very good in our governance model. When I say that, when you can see on the right hand side, when we say about multisectoral action plan, we have 82 key actions and we have 14 key agencies. And I have just put few examples here that we are pushing healthy municipalities and cities, health promoting schools and institutions. By this health promoting schools and institutions, we try to instill this idea of non-communicable diseases and healthy cities to the school children, so that becomes imprint in their mindset, and when they become young, they can be a champion for these NCDs. Similarly, we are trying to raise taxes on tobacco, and we recently launched safer initiative for mitigation of alcohol use, and we are doing many things like fat regulation and the food products. And then the most important thing is that we are doing the community mobilization, and there are different type of stakeholders, and everybody is designed in a way that they can come to some of these committees. Either they can be an invited member, and we are trying to make coalition and networks of these people. So in this way, I think Nepal is doing very good on governance model. I will say about the leadership, how Nepal is taking leadership. Recently, we did a leadership course on NCD to all the directors, to the all high-level officials in Ministry of Health and Population. And all these are altogether 27 directors. They joined this course, and all these directors are the future policy makers. And right now, either they are implementers right now, and they are the people who will take up this multisectoral action plan into their in the actions. So right now Nepal is doing whole of the society and whole of the government approach, and I think in the next few years it will be very much, the results will be very much visible. In relation to that, in addition to that, we have launched a program which says my health, my responsibility. So what we are trying to do, that we are trying every individual to be accountable for their own health. And once you are accountable for your own health, so the health promotion and the other guidance which government gives, you are trying to follow those guidance. And in a way, it helps you to build like healthier society and healthy nations. So in that way, government Nepal is actually taking leadership, and I'm very much hopeful to see the results in upcoming years. Thank you. This much from my side. Thank you.
Right. Thank you, all of you. And it seems like your experience point out one of or two pillars. And it seems like leadership, ways of working, governance are important to you. You not mention about, all of you not mention much about resources, capacity, and finance. You know why? Because this is the most important.
Sorry to interrupt. I will just add few on that. So about the co-design, I already said that we are trying to, as I mentioned, that we are having 16 line ministries along with us. So that means that we are co-designing, and we have as we have 82 action points, and many of these action points are all across other ministries. So other ministries are also doing budgeting for all those action points or key action points, and what Ministry of Health and Population is trying to coordinate with them. And if you see our leadership, the governance model, we have put National Planning Commission on the top. So in that way, I think I'm very much hopeful that more and more budgeting will be done, and will have resources. Thank you.
Right. I'm sure the way that we not explicitly mention about resources or finance, because it's important. And the most important, that's why we don't need to mention it out. That's it. But I think we quite run out of time, but I think the last question also important, that I have to question you on the challenges do you foresee for other governments when trying to establish sustainable multisectoral approach using the new health in all policy model. And if you see other governments might have some challenges, do you think how can these be overcome? May I ask Catherine to respond this question first?
Okay. Thank you very much. Actually, on our side, I foresee the challenges. See, we do have this national framework, which each ministry has committed on how they are going to work hand in hand with the health sector to reach the health outcomes. But when you look on the pillars, actually, for me, one of the critical gaps that I'm seeing is the allocation of resources, because there are competing priorities, and sometimes the sector would love to work to the areas that they are directly linked to their sectors. Then the second thing is on the focal contacts. You see, with the government systems, actually staff are getting transferred. So there will be a need of continuous capacity building. We should not assume that once you capacitate people, probably they are the ones who will be engaged with the same roles. Then thirdly, I think there is a need also for having the political will. I think I talked about this. So we need to extend the health and all policies thinking beyond the government ministry. We need to work hand in hand with organs like the parliament, so that they can see the importance of having this kind of mechanism to work across sectors. But also I think we need to brainstorm on how we can deal with the vertical leadership. We have many actors, but when we talk about health and all policies, we are thinking only of the public sector, while you find in some contexts, the non-government sectors like the NGOs, they have a bigger role also playing in the health sector. So we need to think how best we are going to use the role of the non-government organization working on other sectors, complementing to the social determinants of health. This is what I can foresee. Probably we need to think through beyond the public sectors. Thank you.
Thank you that you raised this up and also give us how to overcome it at the same time. Good point. May I go to next, Horacio, please? Can you build up on from Catherine?
Yes, first of all, I think Catherine has explained very important issues. I don't want to repeat exactly, but at the same time, I would say one challenge is to maintain the commitment and the leadership on this. That will help to have the financing, which is very important. And I think that we must understand that it's investing when we give money on those aspects. It's not spending money. It's investing if you want to maintain our systems available. Even rich countries like Canada could not afford if we don't do prevention. The health impact of the different disease, chronic disease is very important. And we will, if we want to keep our system free and available for us, it's important. And I think one important issue is to also make some evaluation of what are the impacts of those policies and making the government understanding that the NGOs and the society have seen the benefits from those approaches, killing silos. I think that the evaluation part is something that we're going to be asked. And it's not always easy because it's very complex, but we should probably at least make the cases of change that happen through that approach that will make more coherence and I would say make more capitalization on what is already invested. And my dream is that to see on the media people asking for prevention and those actions more than what we see when somebody don't have this medication or this medication, because governments reacts to the population and they react to the needs is also through that. So I think that's a challenge and it's a continuous work. As I was telling, there is a lot of people turn around in different ministries. We must make sure that we maintain that leadership at all levels. And I would say even in ministerial levels, I hope my prime minister will do the launch of this new plan with different ministers to really make people understand that we work together.
Right, good point. I would like to go over to Sangeeta, please.
Yeah, so when we are talking about the challenges, there might be many challenges. The first challenge which I see is the shared vision. So right now when we have launched the document, everyone is on the same page and same ground. But because as the leadership changes, there might be a change in political leadership, in the bureaucratic leadership and other leadership. Will this shared vision will be the same or not? So that is what sustained work on the shared vision is a very important task all across the countries. The next point which Horacio was saying that I must agree that resource allocation is one issue, but resource prioritization is a very important issue. Like you might have resource constraint and then you look for resources. But even if you have resources, the prioritization of the resources for the specific agenda is a must. So we need to think about resource prioritization. And yes, we should look for additional resources. The another thing which in my mind is like about the ownership. how can this ownership can be taken from the political ownership to the individual ownership? Because NCT, as I already said, Nepal has launched My Health, My Responsibility. And I think if all of us cannot do this thing, that it is my responsibility, if you take the ownership of your own health, I think things becomes much easy, and it goes with the pillars and the overarching principle. And the fourth thing is about the equitable distribution of the resources, which is our main guiding principle in health in all policies. Because if you leave certain sections of the society who are where you need more resources, more work, so that is more important that you think about the disadvantaged and marginalized population. The most important thing which I feel the solution can be a persistent advocacy. We need advocates, we need more advocates. They can be from the sector, they can be from other sectors as well. So we need more advocates and we need more champions who could do this advocacy all along. The second thing would be joint planning and financial and arrangements for the actions all across the ministries. So there may be one action that involves 3 ministries or 4 ministries. They can do their planning jointly and they can monitor their plan jointly. So joint financial arrangements as well as joint monitoring of the activities is a must. And third thing which I will say is the political will and the persistence. Persistence is the key. If we are not persistent, it will be like some other document or something other else. So it has to be built over the time. So my main message will be the political will and the persistence. Thank you so much.
Thank you. Sorry that the last person will be, I'm not sure it's going to be very difficult or not, that other already covered many good points, but I would like to hear from Peter.
Okay, maybe I'm the most unlikely to end this because I'm coming from the regional level, but okay. Well, I think the challenge actually is this word or keyword sustainable, how to maybe sustain this cooperation beyond any program, beyond national strategies, beyond political mandate, or let's say that it's not dependent on political will as they all pointed out, or it's much dependent. But I don't know really how to solve this. There are few tools or few available practices that you can already see. Maybe some of ours was keeping working ministries together is to pool resources on different topics. So they really have not their separate funding streams, but actually pooled resources. Maybe that's one. And from our experience in regional level, where we do have to get resources even for the working of such a group, not put in, we don't have people in place to work that. We do this, let's say, voluntarily. It would be nice to have maybe some structural funding for this work, or funding projects in this type of works. And of course, I will emphasize once more the capacity building in all sectors, because when people in other sectors are aware of what we are doing and what is the issue here, they're really much more likely to help and much more willing to help with health in all policies and things that we are trying to achieve better health. So invest in capacities, invest in people, invest in the values.
All right, thank you. Thank you. I think what I hear from our panelists is 5 keywords. That is political will, ownership, effective investment in all kinds of investment, co-benefit, and the most important, continuity and persistencies. I have to heartfelt thank you for all panelists for your contribution to this panel discussion. And it shows that we invite the right panelists who have hand-on experience. The that whatever you say is really makes sense and it will give the guidance more valuable. I would like to hand over to Nicole for the closing remark. Thank you.
Thank you, Nanu. Thank you, everyone. We've run out of time, so I'm going to be very short and just say a big thanks to everyone. We have a register of people who attended this webinar. We're looking at finalizing the guidance, including some of the issues and comments raised here, as well as some internal consultations we're doing in WHO. And that would look to have the launch of it probably towards the end of the second half of this year. But we're really struggling. We really want to make it this year. So we have your names on the list, and we'd be very happy if you wouldn't mind. We would send you an invitation to the launch event. Yeah, so thanks very much to everyone. We are also in the global network, which we also support, following up with Q&A sessions, which we hope also will be in the second half of the year, once the guidance is in its sort of final stage. So we hope that this has been of interest to you, and we look forward to inviting you to future events, and hopefully also having your participation perhaps as speakers. So thank you and farewell.